If you're worried about how policy changes could hit your monthly budget, you're not alone. A lot of people are asking the same questions right now. Will my health coverage get more expensive? Will my plan change? Is there a chance I could lose benefits I rely on? I know that when you're living on retirement income, Social Security, a pension, or a fixed budget, even a surprise increase of $50 can throw everything off. And when it comes to health coverage, it's not just about money. It's about whether you can see your doctor, refill your medications, and handle a sudden illness without panicking about the bill. Today, I'm going to walk you through what happened with the Affordable Care Act tax credits, what it can mean for you or people you care about, and what practical steps you can take to steady the ship. My goal is simple: help you understand the rules clearly, protect your rights, and keep you from being blindsided. Over the past few years, many people who buy their own health insurance through the Affordable Care Act marketplace received extra help in the form of larger tax credits. These credits lowered the monthly premium, what you pay each month to have a health plan. The added help was temporary, and it did a lot of good while it lasted. Enrollment went up. Out-of-pocket costs went down for many. Older adults not yet eligible for Medicare, early retirees, self-employed folks, and gig workers often found that for the first time, a decent plan was actually within reach. If you or someone in your family used the marketplace instead of employer coverage, Medicare, or Medicaid, there's a good chance you felt that relief.
Now, the temporary boost has ended, unless Congress acts to extend it again. What that means in plain language is that the credits are scaling back to the older rules. The headlines can be confusing, and notices in the mail are not always clear, so let me slow this down. The ACA has always offered premium tax credits for people with moderate incomes who buy their own coverage. The temporary expansion simply increased the size of those credits and made more people eligible. Without the expansion, the help shrinks, and some households that used to qualify may no longer qualify at all. For people whose budgets are already tight, even a small change can be the difference between keeping a plan and going uninsured. You might be wondering what this actually looks like in real dollars. It varies by your age, household size, where you live, and your income. In many cases, people are seeing premiums jump by $50 to $150 a month. That is enough to force hard choices about groceries, utilities, and car repairs. For some households, especially those just above the old income limits, the increase can be much larger. Before the temporary boost, there used to be what people called a subsidy cliff. Once your income went just above a certain level, your help could drop to zero. When that happens, it isn't a gentle increase, it's a wall. For a 60-year-old early retiree or a couple in their late 50s buying coverage on their own, that can mean hundreds of dollars more each month. I wish I could tell you that everyone will see small changes, but that wouldn't be honest. Some people are looking at very big numbers.
There's a reason this hits older adults under Medicare age particularly hard. Insurance is priced by age, and premiums are allowed to be several times higher for someone in their late 50s or early 60s than for someone in their 20s. The tax credits were designed to ease that gap. When the credit shrinks, the raw premium is still sitting there, and it can be steep. I'm not sharing this to scare you. I'm sharing it so you're not caught off guard, and so you know where to look for ways to manage it. Let's make this more concrete. Imagine a 62-year-old early retiree living alone with an annual income of around $40,000. Under the larger temporary credits, they might have paid a reasonable monthly premium for a silver plan that covered their doctor and medications. Without the extra help, the expected contribution toward premiums rises and the tax credit falls. The same plan might jump by $100 or more each month. Now imagine a couple in their late 50s with a modest retirement income that just crosses the old threshold. Under the expanded credits, they qualified for help. Without the expansion, they may get little or none. That's where you can see increases of several $100s a month, depending on the plan and the county. These are not exact quotes, and your numbers could look different, but the general pattern is consistent.
A lot of families are now doing math at the kitchen table. They're asking whether they can squeeze more out of the food budget, skip a dental cleaning, or delay an appointment with a specialist. The toughest decisions happen when the math simply doesn't work. In those cases, people drop coverage and hope they don't get sick. That isn't laziness or irresponsibility. It's what happens when the options feel impossible. I want you to know you are not alone in feeling worried or frustrated. Many people have written to say they did everything right.
worked for decades, saved what they could, followed the rules, and yet they still struggle to afford healthcare. Your feelings make sense. How did we get here? In simple terms, the temporary boost to ACA tax credits had an end date. Lawmakers knew the deadline was coming, but they did not reach agreement on extending it before leaving town for the holidays. Some argue the subsidies are too expensive and that the market should shift toward high-deductible plans, health savings accounts, and other tools that give people more direct control. Others argue that the credits are a proven way to keep people covered and that pulling them back will reverse progress. Even within political parties, there are different views. Representatives from districts where many constituents rely on this help raised concerns. Some pushed for votes, but the clock ran out without a solution in place. That is the reality on the ground as we speak. Sometimes Congress revisits issues early in the new year. Sometimes they pass retroactive fixes. I will keep an eye on that, but I don't want you to wait around hoping someone else will sort it out. There are steps you can take now.
First, know whether this change affects you. If you are on Medicare, this particular issue does not change your Medicare premiums or coverage. Your Part A, Part B, Part D, and Medicare Advantage rules are set through different processes. If you receive Medicaid, this change does not cut your Medicaid benefits, though your state may have its own renewal and paperwork timelines that you should track carefully. If you get coverage through your employer or a retiree health plan, the marketplace credits do not apply to you. The group most affected is people who buy individual coverage directly through Healthcare.gov or their state marketplace. If that's you, or if you have adult children or grandchildren in that group, keep listening. Second, log into your marketplace account or call your state marketplace to double-check your plan and premium. Make sure your household size and income are accurate. Even without the extra boost, smaller changes in reported income can affect your tax credit. If your income is lower than you estimated earlier, you might get more help than you thought. If your income went up, it's better to update now than be surprised at tax time. While you're there, look at the plan options again. Sometimes a similar plan from a different insurer has a lower premium. Sometimes a silver plan with cost-sharing reductions, if you qualify, can be a better deal than a bronze plan with a lower premium but very high out-of-pocket costs. Make sure your doctors and medications are covered by the plan you choose. If cost is the main concern, run the numbers carefully. A slightly higher premium for a plan that covers your medications might save you money overall compared to a cheaper plan with worse drug coverage.
Third, check whether you qualify for Medicaid based on your current income and your state's rules. In states that expanded Medicaid, adults with incomes up to about 138% of the federal poverty level can qualify. If your income fell because you retired early, lost work hours, or had a slowdown in your business, you might be eligible now even if you weren't before. In states that did not expand Medicaid, eligibility rules are stricter and many low-income adults don't qualify. If you live in one of those states, I know that's hard to hear. In that case, you'll want to look closely at the least expensive marketplace options and also learn about free or low-cost care in your community. Fourth, if you are truly up against it and considering dropping coverage, pause and map out a plan before you cancel. Ask whether you qualify for a hardship exemption that could let you enroll in a catastrophic plan even if you are over 30. Catastrophic plans cover essential benefits and protect against very high bills, though they have high deductibles. They are not right for everyone, but for some people, they can be a bridge that keeps you protected against the worst. Be careful with short-term plans sold outside the marketplace. They may look cheap, but many do not cover pre-existing conditions, prescriptions, or basic services. Always read the fine print. If you take medications, call your pharmacy and your prescribers to ask about lower-cost alternatives, generic options, manufacturer patient assistance programs, and community programs that help with copays.
Fifth, if you do lose coverage or go without it for a while, know where to turn for affordable care in the meantime. Look up community health centers in your area. They offer primary care, mental health services, and sometimes dental care on a sliding fee scale based on income. They will work with you even if you do not have insurance. Nonprofit hospitals are required to have financial assistance policies. If you need hospital care, ask for a screening for charity care or reduced charges. Do it early if you can. Keep copies of every bill, every letter, and every phone call note. It might feel tedious, but it helps. If you get a big bill, don't ignore it. Call and ask for an itemized statement, check for billing errors, and ask about payment plans. Many hospitals will reduce charges for people with limited income, even if they are not officially labeled as charity care. Another point I want to highlight is your rights under the marketplace rules. If the marketplace made an error in calculating your eligibility or applied the wrong information, you have the right to appeal. If you receive advance premium tax credits during the year and you fall behind on payments, you may have a grace period to catch up if you have already paid at least one full month's premium and you continue to qualify for tax credits. Know your plan's rules and deadlines. If you have a qualifying life event, such as moving, getting married, losing other coverage, or a significant change in income, you may qualify for a special enrollment period to switch or enroll in a plan outside of the regular open enrollment window. If you work with a local navigator or certified counselor, they can help you understand these details at no cost.
A lot of you also worry about tax time. If you received any advance premium tax credits during the year, you will reconcile them on your tax return using Form 1095-A. If your income ended up higher than you estimated, you might owe back some of the credit. If it was lower, you might get more. This is one reason it's important to keep your marketplace information up to date. If you feel overwhelmed by the forms, look for free tax help through the IRS Volunteer Income Tax Assistance Program, AARP Tax Aid, or another trusted local service. Don't let confusion keep you from filing correctly. And don't forget that reporting changes during the year protects you from bigger surprises later. You might be wondering how all of this connects to other programs you care about. In short, the shift in ACA tax credits does not change your Social Security payment schedule. It does not change how your Medicare premiums are set for the current year. It does not cut your SNAP benefits or your Medicaid eligibility. Each program has its own rules. That said, your household budget is one big picture. If a higher health premium is squeezing you, it is completely reasonable to make a plan for everything else. Confirm your Social Security direct deposit date. Make sure your SNAP renewal paperwork is in on time. Check the status of any disability claim or appeal. If you are on Medicare and your income is limited, check whether you qualify for extra help with prescription drug costs or a Medicare savings program that can pay your Part B premium. These programs are based on income and assets, and they can free up money in your monthly budget if you qualify. For those of you in your early 60s planning for Medicare, this is a moment to map out your timeline. Know your initial enrollment period for Medicare so you don't miss it. If you are retiring and losing employer coverage, learn the rules for special enrollment periods that prevent penalties. Keep an eye on your modified adjusted gross income if you are close to the thresholds that trigger higher Part B and Part D premiums. This isn't to make you anxious, it's to help you keep control. A clear plan reduces stress.
I also want to be transparent about how this affects communities. When people lose insurance, they don't stop needing care. They delay appointments, skip medications, and hope the cough goes away or the pain stops. Then they show up sicker, and the care is more expensive. Community health centers see longer lines. Charitable programs that help with medications end up stretched. Rural hospitals, many already on thin margins, face more unpaid bills. This pressure doesn't stay in one place. It can lead to longer wait times, tighter staffing, and higher charges for everyone. The costs don't disappear, they shift. At the same time, remember that you are not powerless. There are levers you can pull. If your income is close to the limits, check whether adjusting your expected income for the year, for example, by changing a planned IRA withdrawal, can help you qualify for a better credit amount. Be careful and talk to a tax professional if you're unsure. Compare plans with a fresh set of eyes. Some insurers adjust prices in ways that make one metal level a surprisingly better deal than another. Look at silver plans if you qualify for cost-sharing reductions. If you're managing a chronic condition, call your doctor's offices to ask which plans they accept this year and whether they can help you estimate your annual costs under different plan options. This legwork takes time, but it can save you money. If you provide care or financial help to an adult child or an older parent, you can be a bridge for them during this time. Sit down together and log into their marketplace account. Help them gather their income documents. Call a navigator together. Ask their pharmacy to run a price check on their medications across different plans. Make a simple list of their doctors, their conditions, and their prescriptions. This short list is your compass when comparing plans. Let's talk about how we got to this point without getting lost in the weeds. Healthcare policy in our country has been debated for years. One side worries about the cost of subsidies and prefers approaches that rely on people choosing lower premium, higher deductible options, sometimes paired with savings accounts. The other side believes that keeping people covered is a priority worth funding and that the credits have proven their value. Both sides point to rising overall health costs and say the system needs fixing. They disagree on how to fix it. What matters for you is that while these arguments continue, the rules on the ground can change when temporary measures expire. That's why staying informed is so important. It doesn't mean you have to read every bill or track every hearing. It means checking your plan once or twice a year, opening your mail from the marketplace, and knowing who you can call for help. In the months ahead, you may hear talk of new proposals, retroactive fixes, or future extensions. It's okay to hope for improvements, but build your personal plan based on what is actually in place today. If something changes in your favor, great, you can adjust. If nothing changes, you will have already taken the steps to protect yourself and your family. I also want to make space for how this feels. Healthcare stress is exhausting. It mixes money, health, and uncertainty in a way that keeps you up at night. If you are upset, you are not overreacting. You're reacting like a person who has been asked to carry too much. One way to make that load lighter is to turn the big, scary problem into a short list of small actions. Then, do one at a time. Today, log in and confirm your information. Tomorrow, call your doctor's office and ask which plans they take. The next day, contact a navigator. If you need to, ask a family member or a friend to sit with you while you do it. Sometimes, just having someone there makes it easier. To recap the heart of the matter, the extra help that lowered marketplace premiums for many people has ended, unless lawmakers extend it again. That means higher costs for some, especially older adults not yet on Medicare and households just above the old income cutoffs. It does not affect your Social Security check, Medicare coverage, or SNAP benefits directly, but it can strain your overall budget. You have rights and options, including the right to appeal marketplace decisions, potential special enrollment periods for life changes, and access to community health centers and hospital financial assistance if you need care without insurance. The next best steps are to check your plan, update your income, compare options again, and see whether you qualify for Medicare in your state. If you become uninsured, plan ahead for where you will get care and prescriptions, and ask about assistance programs.
I know a lot of you watch because you want straight talk that doesn't scare you, but also doesn't sugarcoat things. That's what I'm trying to give you. You deserve to understand the rules, to know your rights, and to feel confident about what to do next. If this affects you, please take an hour this week to review your coverage. If you have a loved one who's under 65 and buys their own insurance, share this information with them. And if you hit a wall or get a letter you don't understand, ask for help. Marketplace navigators exist for exactly that reason. Your doctor's offices and pharmacies can also be allies in finding practical solutions. As we wrap up, take a breath. You're not behind. You're not alone. Step by step, you can protect your health and your finances. Keep your paperwork together. Write down who you talk to and what they say. Set reminders for deadlines. And keep living your life while the policy debate continues in the background. You don't have to follow every twist and turn. You just need to know how to respond when the rules touch your life. If you found this helpful, share it with someone who needs clarity right now. If you have questions you want me to cover next, tell me what's on your mind. I'll keep tracking the updates and explaining what they mean in clear, everyday language so you don't get blindsided. This video is for general information only. It is not legal, tax, or financial advice. Everyone's situation is different. Before you make decisions about your coverage, talk with a licensed navigator, your state marketplace, Healthcare.gov, a qualified tax professional, or your state Medicaid office. Laws and policies can change, and official sources should be your final reference.